right, so tonight's the dreaded or the refresher of our bloodborne pathogens, our class. This is an OSHA mandated class that we do once a year, and it's intended to just keep you informed and updated. A little bit of information about diseases out there, things you can do to stay safe, what to do if you get an exposure, what exposure here looks like, things like that. So feel free to ask questions. Just raise your hand. I'll call on you. I'll repeat it back because I am recording this so that the people that aren't here tonight can have a video PowerPoint to watch and they get to take the test. So for you guys that came and didn't actually stay at home, you don't have to take a written test. So the bloodborne pathogen standard by OSHA is 1910.1030. It's a test question, is why I read it out to you. It requires an agency such as ourselves that provides medical care to have an exposure control plan, to do our required vaccinations, which has been going on all night so far, education and training like what we're doing, talking about post-exposure management and how we track and keep you safe if you are exposed, and then just all the record keeping that goes with that. So a couple things. One, our exposure control plan. Where would you find that if you wanted to look? Jeff?
Captain's office.
Captain's office. There is a place in the captain's office that has the exposure control plan. Where else might you find it?
EMS room.
Nope, there's not one in the EMS room. But good guess. In the truck room, there is not one in the truck room or the apparatus bay. Somebody over here answered? In ESO. Oh, probationary Lieutenant Griffin just pulled that one. Good job. It's in ESO. If you log into ESO on the Forest Grove side and you go into personnel management, there's a library and all of the exposure control forms and our exposure control plan are sitting in there. The exposure control plan sits within the SOGs in that file. So when you have some time and you're out spilling water, Kyle, when you have some time, log into ESO, go into the PM section, and check out the library. There's a bunch of stuff in there that's useful for you. So if in doubt you can't find it, then one of the company officers like myself, obviously Lieutenant Griffin knows where it's at, Captain Richardson knows where it's at, so we can help you find that stuff as well. So when we talk about required vaccinations, obviously we're doing a vaccination clinic tonight. What are the required vaccinations that we need? TB.
Hep B.
Hep B is a requirement. Those are the real big ones. We offer Hep A here just because it's a nice thing to have, especially if we're getting in the water and we're dealing with flooding and things like that. That's where you're going to get Hep A most of the time. Or if you're doing like a public assist and there's poop everywhere, you might get exposed to Hep A. So it's not a requirement, but Hep B is. So that's the big one. And then our TB is it used to be the old annual stick test, but they've changed that now. It's that quantiferin gold that you have to get done every once in a while. So those are the ones we do. We also offer flu shots here, so just keep in mind with that. Obviously, the education and training, you'll get that tonight and then peppered throughout the year on treatment of exposures and things like that. The folks, the gals that are in the other room in there, they're from Occupational Safety, Health, and Wellness. It's a company that caters to fire departments and EMS agencies, and they provide the nursing staff, the flu clinics, the shot clinics, the P-tests, the onboarding tests, the onboarding physicals and things like that for fire departments, and all of the record keeping it's associated with that, as well as post-exposure expertise. So if we have an exposure to a pathogen at any point, they get contacted and then they help track our case, and then they keep those records for the life of you as the employee. So it's very important to make sure that they're aware of what's going on, and we'll go through how to do that from here. Does anybody have any questions? So site-specific stuff. So at Station 4, we have our PPE storage, and Matt Johnston's our logistics guy that keeps both of our stations stocked. He does a really good job of that. But where do we keep all of our PPE for storage? At Station 4. Not everybody at once. EMS room, the EMS supply room. How about at Station 8? EMS room, yeah, pretty simple, right? We also have our biohazard disposals, and they are in or near those same spots, and those are the red Sharps containers on the wall. They're the red Sharps boxes or garbage cans, as well as the Sharps containers that sit inside of the med boxes or our med kits that we carry on the apparatus. When you use or you have a Sharps, you put it in a little red Sharps container on a scene, and then when that's full, it gets sealed shut and put into the red garbage can. What happens when the red garbage can gets full? What do you do? Open it, put your hand in it? No.
Tell Matt about it, he'll have it shipped away.
Tell Matt or just a company officer is fine, and they will either let me know or Matt, and we will call and have them pick it up. Let's make sure that we don't let those things get over full. Let us know within time so that we can call and get the company out here. They come on Thursdays. So if it's Friday morning and it's heaping over, we've created a problem, right? So when it's about 3/4 full, let somebody know so that we can get it empty. They come, they replace that bin, they take the old bin away, and then they go and incinerate it. So all of that stuff goes away. We don't want to be messing with it. So Chief Black is our Bloodborne Pathogens coordinator. So he's the one that gets to organize this night and cajole me into teaching this class for him. And since I love doing it so much, here we go. And then he keeps track of our exposure reporting protocol, which we'll get into here. So on the right-hand side in the pink is if you have an exposure. This is kind of the area that you're going to look for. And this is our accident near-miss form. If you have an accident, your company officer should be going to this and trying to follow this verbatim. One of the things on there to pay attention to is the call-down list on the bottom left. You're going to start with Chief Black, and if he doesn't answer, you'll move on to Chief Niemeyer. Then if he doesn't answer, then it's Chief Weinman, and so on. One of those four folks will be answering the phone, but start with Chief Black, especially if it's 2 in the morning and he's in Canada on vacation, right?
Appreciate it. Yeah.
You're welcome. His number is 5 now. This is what the exposure reporting protocol looks like. So we're going to kind of look at this. This is in that same form that's in the ESO section in the which subfolder? PM, Personnel Management, and then in the library. So the service has got a phone number. It's that 1-877-436-7669. And then at the bottom, there's another number. That's the 503-707-2717, followed by an email address. What's the difference between those two numbers as you look at this? One's for exposure and one's for admin. So if you have an exposure, you're going to call the 1-800 number. If you need a copy of your vaccination records, you want to know what your vaccination status is, you have a question because you're going to go to EMT school and you need an immunization that you didn't get here that the class is requiring, can you get it through them? This is who you call. You call, her name's Linda, at Occupational Safety, Health, and Wellness. You can call her at the 707-2717 number, or you can email her, and she will give you access to all of your records, or take records that you have. Like tonight, if you showed up and you didn't have access to all your records, they don't have them in there, but you have them at home, you can email them to her, and she will get them uploaded in the system. So admin stuff goes to the bottom number or email address, and then in the event of exposure, you're going to use that upper number. Is that clear as mud? Oh, the C shift team, Station 4, just arrived. Everybody should bow. Give them a round of applause. Where are you guys going? You can sit down. Greg's embarrassed. The sign-in sheet, sign-in computer's here. If anybody didn't sign in, sorry. Please sign in and pass it around. There's a bunch of people that need it. So when we talk about PPE and how we prevent these things from coming in, which PPE are we talking about? Our gloves, which we provide for you, our eye protection, which we will provide for you, surgical masks, N95s, and gloves or gowns and Tyvek suits. We provide all of that stuff if it's necessary. So where do you find it? In the EMS room, yeah, but when you need it, you probably need it on a call, right? Is it in the rigs? Yes, except for the eyewear. You should be issued a set of eyewear. If you're not, either come see me or a company officer and we'll get you a set of eyewear. You should be wearing it on every medical call. So we want to make sure we're using our PPE. And then when we look at some of the current trends that are out there, COVID is still around, still there. I know some people think it's fake, but it's not. Stay boosted. It helps. It's not going to prevent you from getting it. It's just going to help your symptoms. Wear your PPE. From my experience, I have been wearing a mask since COVID started. I still wear a mask on calls, mostly because during COVID, I lost my ability to handle those nasty smells, the rectal GI bleed smell, the feces or urine that's been concentrated for days. My stomach I lost the ability to handle it very well. So now I just put on an N95 and I don't have to smell it. So it's been great for me. And I don't get sick as much. So wear your PPE. If you're symptom-free, no problems. But if you have symptoms, you think you might have COVID or a positive COVID test, you're going to call the 971 number. Does anybody know whose number that is? Lexi, do you know? Do you know whose number that is? You want the tablet? But if you don't know the answer to the question, you don't get credit. This is Chief Weinman's number. He's our COVID specialist. So if you have COVID, you want to report it, you can send it to Chief Weinman. So current trends outside of the COVID stuff, we still have monkeypox running around. There isn't very many cases, but it's there. It's one of those diseases that you can get if exposed. Skin-to-skin contact, I don't think you want it. It's kind of gross. Very few cases, but it's one of those things that's still around. The flu. The flu's out, and it's in full force right now. So if you didn't get a flu shot tonight and you want one, make sure you get one. If you've already had your flu shot, great, good on you. If you don't believe in flu shots, that's fine. Wash your hands, wear your PPE. Don't come to work sick, right? So be symptom-free when you show up. Measles. Measles is making a comeback. So during COVID and a little bit before, we've kind of got this anti-vax movement happening, and there's a lot more people that are not vaccinated as kids that are now contracting measles. There's close to 100 cases in Oregon right now, so pay attention to that. It is out there. If you've been vaccinated, you're not likely going to get it, but I still want you to wear your PPE. It's just one of those things to be aware of. And you may not get it, but it may be something your patient has and something you want to alert the hospital to so we can help prevent it. Norovirus is one of those always current trends. It makes its way through fire stations pretty fast. This is one of those that you pick up on scene Can be airborne or particulate, and you get that nauseous feeling, you start vomiting, and then you are doing both at the same time. We don't want this in the station, right? I'm going to put you gearing on the spot. Like, you bring noro into the building, you're going to decimate an entire company, and with our small agencies, we can't afford to do that. It really takes out a lot of people. There's been many stations that have had an entire station get out because of noro and how transmittable it is. So good hygiene in the stations, make sure we're cleaning up after ourselves, making sure we're not being slobs, but we're also washing our hands when we use the bathroom. We're also wearing our PPE when we're on calls. We're not wearing our PPE still in the building. We're cleaning our equipment before we put it back in the engine. We're not tracking dog shit around. I don't know. So funny story, last shift, Greg gets in the rig and he's like, God, who farted? Who farted? I smell shit. Are you sure it's not you, Greg? I smell shit. It smells like dog shit. So he finds that he has a big giant clot on his boot. So he found it. It was good. So MRSA. What's MRSA? Yes, it's a it's a staph infection that has been treated with a bunch of antibiotics or didn't get quite enough, and it now doesn't take hold with antibiotics, or somebody didn't take all their antibiotics. So it's a really hard to kill staph infection that leads to big boils and blisters and can get you septic and kill you. But it's also very highly contagious. So we want to make sure if somebody has MRSA, we're also wearing our PPE like always. But we're going to be super diligent, make sure we get everything clean, right? Make sure that blood pressure cuff is getting wiped down on every call, not just when you think it smells bad or looks gross, but clean our equipment. Who thinks about cleaning the EKG cables every time that you put on a 4 lead or a 12 lead? I know I do. I know C-Shift does. I know Station 4 is very diligent about cleaning the monitor, getting that stuff cleaned up. Just imagine being that person that got the dirty blood pressure cuff or the dirty stethoscope on the next call. I don't want that. So let's make sure we're being good stewards and cleaning our stuff. So we'll talk about HIV a little bit just because it's still out there. HIV is a nasty thing that leads to AIDS, and obviously it infects your T cells. It's one of those that's transmitted by blood, semen, or vaginal secretions. And obviously we shouldn't be coming in contact with all of that stuff, but we come in contact with blood, we deliver babies. We see some weird dudes out there in this industry, so you are potentially going to come across that stuff around. So we want to make sure we're wearing our PPE always, but just be very careful about all of that kind of stuff and your exposure to it. It's not transmitted in urine, feces, saliva, or vomit unless there's blood in those 4 things. Then it can be transmitted, but it has to have blood in it to be able to transmit. Is HIV curable? It is now treatable. It's no cure, but you can control it with proper treatment. Now, how expensive is that treatment? It's a lot of money. So it's very expensive, and the side effects of some of those medications are pretty horrible. So let's not, if you get HIV, let's make sure you didn't get it on the job, okay? That's our whole goal, is to make sure we don't get it, but definitely don't get it on the job. So in Oregon, there's still some 5,000 plus people to be HIV positive. There's about 200 new cases annually. Most of those are in Multnomah County. Washington County has about 900 to 1,000 cases. So there's 1,100 or so folks in Oregon that don't know they have it. So be careful what you're doing on your days off and who you're doing it with. as Leith used to say, she used to be the one that teaches this. If it's wet and not yours, don't touch it. What?
If it's wet and it ain't yours, don't touch it without PPE. Well, if you're going to be involved in it, you have to be there for your PPE.
Let's rephrase. Let's make sure we get this right. Okay? If it's wet
and it ain't yours, don't touch it.
and not yours, don't touch it. If you're in the capacity of your work, it's wet and it's not yours and you're delivering the baby and you have to touch it, touch it. But wear your PPE. I get it. So I don't worry about HIV as much because HIV it's not a very stable virus that lives outside of the human body. So the one that I worry about is hepatitis, and specifically Hep C. Okay, hepatitis A, we already talked about the vaccine for it. Hep B, the vaccine for it. Hep C is the one that's pretty prominent and creates a bunch of problems. And then the other hepatitis are pretty rare. But currently there is no Hep C vaccine. So it's out there. Hep C also, I'll get to that in a second. So Hep A, fecal oral transmission, like I was talking about earlier, it survives in the water. So during floods, when we have a lot of sewage in the water, people get transmitted with, or hepatitis A is transmitted a lot easier. It can survive for more than 4 hours outside of the body on unwashed hands, but there is a safe vaccine that's available. It takes 2 doses. Hep B, there's fewer new cases regionally. It can survive for 7 days outside the body. This is pretty brutal. Meaning it can sit on a bench in an ambulance or on a stethoscope or a blood pressure cuff or a EKG cable pretty easy for up to 7 days. So there's a bunch of carriers out there, and like I said before, there's a safe vaccine available. We offer it tonight. You get your first dose at 0, so the day you got it. A month later, and then 6 months, you get your third, and then you get booster doses and tested to make sure it took. You may decline to receive your immunizations, but that's a whole process. If you need to do that, come see me, or actually go see Chief Black. Hep C, transmitted by blood and body fluids that contain the virus. There's a bunch of folks in the U.S. that are infected. Mostly it's the IV drug users is the highest risk, and there's no vaccine available. The beautiful thing about Hep C that's different now than was when I first started in EMS, and I know I'm old because it was last century, but is there's now medications that can, if you catch it early enough, you can start medications that prevent you from being inoculated to it. So let's say you're exposed to somebody with Hep C through a cut or some catastrophic event that created it. It's a legit exposure, and you know that the source patient has Hep C. There are medications that they can put you on to prevent you from actually converting and getting Hep C if you catch it early. Hence the reason that, and we'll hammer this again, that as soon as you're exposed, there's a bunch of steps that notify your company officer and start working through the exposure control plan so that we can prevent that for you. Now, just because you're exposed to blood or bodily fluids doesn't mean we're going to start giving you all of these medications. We're going to evaluate and test the source individual, do a bunch of evaluations to see if it's even possible that you get it. But we go through a bunch of steps, and those are all based on science. Hep C treatment, you can take this blood test like I was talking about, greater than 95%, but it's super expensive. So we don't want to go down that road if we don't have to, and the side effects of that medication can be pretty brutal as well. Does anybody have any questions so far? I know I'm going pretty fast, but I'm trying to make up time for the folks in the hallway that slowed us down. All right, so when you have hepatitis, sometimes your symptoms, you can get that. Oh, I didn't see that. I only saw 3.5 fingers. Small hand.
Hep B, and if you have whatever.
Yes.
We cover that too.
No. There's not much information. It's pretty small, like your hand. So if you didn't notice, he's missing some fingers.
You get 20% off.
So hepatitis, especially hep C, you can be fatigued, you can have some jaundice, flu-like symptoms, dark urine. This is a pretty extreme case of jaundice, that yellowing of the eyes and the skin. You can have clay-colored stools. Who actually looks at their stool when they go? If you don't, you should. It's a good way to indicate how healthy you are. I mean, at least look just a little bit. A lot of times they have right upper quadrant abdominal pain. Why are they having a right upper quadrant abdominal pain? The liver sits there. And sometimes they won't have anything and they will still have hepatitis. It's just not in full effect yet, but they can carry it and transmit it. Obviously, we're going to prevent getting this by wearing our PPE. If it's wet and not yours, don't touch it. We're going to wash our hands diligently. Wear that PPE again. We're going to put our sharps in the right spots. We're going to buy, that's Matt and I's job, when we buy equipment to make sure that it's got engineering controls in place. A good example is the Lancets that we use. A long time ago, it used to be just used, you'd pull off the plastic tips, poke somebody, and it was still a sharp there. Now they retract on themselves. It's almost impossible to poke yourself with it after it's been used on a patient. Same with our IV needles. We use as much needleless as we can. We still have hypodermic needles in the system, but those are for IM and sub-Q injections. So very limited opportunity for us to get an exposure from a sharp that's been inside of a patient. So think about that. Do we recap needles? No, let's just put it right in the sharps container. If you're going to recap it because you have to, set the cap on the counter or the table, and then none of this stuff because then you'll poke yourself. Put the sharps where they're supposed to be. If the sharps container is full, and there's a bunch of you in here that have heard this story, but I watched a colleague of mine, he was my captain years ago. He grabbed the sharps container out of the bottom of the kit with one hand, set it in his other hand, and then he turned pale white. And this is a guy that never got pale white about anything. He handled calls flawlessly. He was great. What had happened is the crew, the shift before, they took the scalpel from the childbirth that they had, where they cut the umbilical cord, and it didn't quite fit, so they pushed really hard and just pushed it through the bottom of the sharps container. So when he took the sharps container out and set it in his hand, he cut his hand with the bloody, nasty scalpel. It's pretty gross. So let's not do things like that. If it's full, take care of it and let's get it disposed. Or let's not have full sharps containers on calls. Do your checks. Okay, no surprises. So we have these airborne pathogens out there. COVID is an airborne pathogen. TB is also a airborne pathogen, spread by sneezing and coughing, and it's one of those that can get us. But we have a TB test, so we're testing ourselves for it. Make sure we don't have it, we don't get it. The best way to prevent it yourself from getting it is that wear a mask. Makes it easy. What's that?
I said live alone.
Chad's philosophy on everything. Live alone, be a recluse. As he's got a sucker. Prolonged productive cough, fever and chills, night sweats, weight loss, loss of appetite, coughing up blood, chest pain. So worry about these people that are coughing up blood on scenes. Make sure you're masked up so you're not getting any of those particles. We don't want to get TB. It will shorten your life. So we test you at higher, and then we test you annually. That's that quantiferin gold I talked about before. But we want to make sure that we wear our PPE and we document those exposures. I'll get into how to do that next. Um, if you've been exposed, sometimes you can take some medication that prevents you from infecting others. So you need to follow up. You need to do a bunch of things that can help prevent you from getting it if you're exposed, is what this whole slide's about. But you have to be watched and tracked, and lots of X-rays and things like that you're going to have to go through to make sure you don't have TB. So we'll talk about our levels of exposure. So there's level 1, level 2, level 3. Level 1, if Chad Toomey's the exposure, he's the pathogen that's in the room. All of us have a level 1 exposure because we're in the room with Chad Toomey. Okay? So level 1 exposure, pretty low risk. So level 2 means that he was sweaty and he walked by us and he got some on you, some of him on you, his sweat on you, but he didn't get it in you, right? Level 3 would be he spit on you and it got in your eye, okay? Or he dripped his sweat on you and it got in your eye. Or he was bleeding and it got into an open wound. Make sense? So level 1 exposures, we don't typically worry about too much. If you're wearing your PPE, it should not be a problem. Level 2, if you've got your PPE on that's proper, shouldn't be a problem. Level 3, if this has happened, you either didn't have your PPE on or you had a wound or something that was exposed that wasn't covered, right? So you're working in your yard, you cut your arm, you have a laceration, it's open, you're letting it breathe, you don't have a Band-Aid on it, and now the trauma patient's dripping and you have a puncture in your skin, you've got blood on your arm, it's pretty gross. So things to think about if you are coming to work, make sure that any open wounds that you have are covered, sealed up nice and tight, because you never know when the muck is going to get on you. So a good story is a patient that we had that has cellulitis, which is elephant-style legs with just weeping wounds. If you've run any medical calls, you've seen it. This gal is probably 400 pounds. She sits on the gurney, and she needs help up to turn. So I reach over and I grab her leg, and as I lift her right leg up to spin her onto the gurney, because I was on the right side of the gurney, the big, giant, boilish thing that was underneath opened, and it kind of made that, and I felt the warmth on my foot and down my leg and across my forearm. And I'm really good about not getting stuff on me, and everybody saw me, and I turned green, and I wanted to go. I didn't. You don't know when that stuff's going to happen. So any intacts, any punctures, any road rash if you're a skateboarder, any of that kind of stuff, you have a chance of getting those exposures. So make sure you're covering up any wounds that you show up to work with. Otherwise, you could get some, and we don't want it. So when we're exposed to stuff, we want to work on some guiding principles. One, let's follow the science. Let's be practical, and let's keep our emotional response out of it. Obviously, we might panic, but this stuff has been studied a lot, and the incidence of occupational exposures to any of the things that we've talked about are very, very low, especially if agencies are following the engineering controls and following the best practices that we've been talking about. It's very unlikely that you'll get an exposure in your career if you're doing the right things. So, and you report it, and we follow the post-exposure protocol. Odds are really good for you. It's the people that have an ego, that don't want to follow the rules, that don't want to do the vaccinations, that don't want to report to their company officer that they have an exposure, that are going to be the problems. Make sense? So some of the things that help us is back in the 90s, there was a House Senate bill that was passed to allow companies such as Occupational Safety, Health, and Wellness, if there's an exposure, go to the hospital and get a blood test from the source patient and find out if, in fact, they have something. So it's an Oregon law that allows us to be able to go and get blood tests under certain conditions. It has to be a level 3 exposure. They have to be a high-risk person, but you go and you get that blood test. You can do it without their consent. Nobody else gets to know about it but you and the company that you're working with. And then we can determine what the best treatment is for you. So that's a good thing. Again, source testing, and then a lot of hospitals have rapid testing options. So they can start the testing process within hours of your exposure, so we can track if it's actually taking on or not, as well as any of the other little things that we need to do. So technology is helping us. What we don't want to do is freak out. So keep calm, notify your crew, your supervisor, or your crew. So in my case, if I don't have a supervisor around, I'm going to notify my crew, hey, this is what happened. If it's one of my crew, they're going to tell me, and I'm going to help start the process. You're going to go and wash needle sticks, cuts, and all skin exposures with soap and water. And don't 20 seconds. We're talking minutes. Really scrub, get in there. Lots of soap, lots of water. Get it flushed out as much as possible. We're going to flush splashes to the nose or mouth with water. And we're going to do that for quite a long time. So think 10 or 15 minutes of flushing as much as possible. We're going to irrigate our eyes with clean water, saline, or a sterile wash. So if we're on scene, we can pour saline bags into our eyes or the saline from the suction unit that's available to flush your eyes with. Use all of that on scene that you can, and then when you get back to the station, you need to find the eye wash. Where's the eye wash at Station 8? Does anybody know? By the EMS room. Look at Stepan. Look at you. Fast. Good job. How about Station 4? Where's the eye wash?
By the shop.
By the shop. Yes. So 2 eye wash stations, 1 at each station. Make sure you know where they're at. And then promptly report all potential exposures. So you're going to report any exposure by following the call down list, and call who first? Chief Black. Yay. Contact him first. Get cleaned up, obviously. Then contact him. Start filling out paperwork. We'll get within 20 minutes or so, we'll get the nurse online, and they'll give you a call back. It doesn't have to be like they're not answering. Just call and leave a message with the service. They'll call you back within 20 to 30 minutes, and you'll be good to go. So most of this stuff isn't super time sensitive other than what we've already covered. Really wash it, flush it out of your system. Does that make sense? So we're going to treat this stuff. We're going to get baseline testing. After we've cleaned it, we've done all those things, determine if you need to start one of those medications that prevents it from taking hold. We'll do follow-up testing, exposure testing, source testing if necessary. So my wife's in the dental industry. I don't know, it's probably been 20 years ago now. She got a needle stick. The doc stabbed her with a dirty needle by accident on a pretty high-risk patient. And she got source tested for months, right? There was a whole process that had to go through, medications, all that same stuff. But she got source tested for months, and then every year she gets tested just to make sure, so that if in fact we can tie it back to that exposure, then we'll know where it came from. So still doesn't have anything. Yay. So things to think about. So just the facts. We don't want to get too crazy. Use reputable sources when you're looking for information, like the CDC, the Oregon Department of Health's website, but not the Oregonian. All right, it's fast, right? Is that fast? Who has questions? Because that is the last slide. Yes, sir.
I just have to let Patrick off the hook here. Unfortunately, COVID is not a reportable thing anymore. You can certainly still call him. Please feel free. But COVID is, the city's changing policy on that. It's just like having the flu. So if you're sick and you have symptoms, stay home. But we don't have to report it like we did for the first game.
Yeah. And I can't emphasize the sick, right? You got a little tickle in your throat and you're like, I'll be okay. Don't come. I don't want it. I'm going to tell you that if you come into Station 4 and you get me sick because you came to work sick, I'm going to be pissed. Because then I'm going to take it home and probably get my wife and my kids sick. You think I want that? If you're sick, don't come in. It's pretty simple. Don't come. I know you might miss out on stuff, but it's why career staff has sick leave. Volunteers, you don't have to, you're not getting paid anyway, so. So just don't, and use that in your general practice. If your other jobs, step on. If you're sick, don't go to Intel and spread it there, because I don't think they want it running around their building, right? If we just stayed home when we were sick and stopped spreading it to the people, like, this isn't the gift of I want you to have it. It's not cool. Let's not share it. So, and if you are sick and you see me at the station, I'm going to tell you to go home, and I'll probably kick you out. These guys have seen me do it. I don't like it. Get out of the building. All right. Any other questions?
Not a question, but just to tell on to that, makes perfect sense what Will was saying about sick leave, very appropriate use for sick. Yeah, don't come to work because you know how the workforce is very thin, and we don't want to sicken others and reduce our pool of workers. So we would appreciate that. Thank you for being here tonight. Will, thank you for the instruction. And I think all of us are looking forward to ripe old ages where we can retire and be safe and free and happy. And knowing this stuff, reporting it, keeping your exposure reports up to date, that's all very important, right, for maintaining your health and your longevity in the business, and again, retiring with a big smile on your face. So, very important stuff. Thank you.
And I know this is fast, but I know the content, and I've sat through a bunch of these. And if you have questions, feel free to sit back and ask. If you're not wanting to ask in front of everybody else, I'll hang around for a little bit. If you have any concerns, feel free to grab me or a company officer and ask. If you can't find PPE or any of those things, ask the questions. Don't be shy. Let's address your concerns, okay? All right, that's all I got then. If you did not sign in, make sure you sign in.